Studying human surgery is one of the most enduring specializations a medical doctor can pursue.
So surgery was one thing that I really had to do. I enjoyed it, I studied it, and I think I was competent. It takes training the hands, training the emotions, training, and all these are built over a long period of time.
Dr. Rogers Kabuye endured 9 years of training until he achieved his childhood dream.
I did achieve what was achievable within the means, but a lot was not achieved because I didn't have the means, yet I had the potential. And now these are the things that really keep on putting your morale down.
But 5 years later, after practicing surgery at Nkokonjero Hospital in Mukono and other hospitals in the country, Dr. Kabuye endured apathy and disillusionment.
And so whenever you realize that your potential is not really utilized, some of us have a tendency to say, maybe I can try something elsewhere.
While at Nkokonjero Hospital in Mukono, one memorable incident happened as he tried to save the life of a mother.
Yes, I drive the woman successfully. She's bleeding in the back seat with a neighbor who was a friend and no one else to attend to her. And we get to Kawolo Hospital and there is no power.
Though he managed to save the mother, the baby died. And these are some of the frustrating moments many doctors endure to offer services in ailing health sector.
And then, of course, we lost the baby. And so that's one of those traumatic moments that the whole system feels, you feel you want to do something, but the system lets you down.
Dr. Kabuye believes job satisfaction is not entirely premised on salary. What he loves most is seeing his patients back on their feet after surgery, but the conditions of service in government hospitals turn them into morgues.
It's seeing that patient walk out of your hospital and all that goes in your mind is, if I wasn't there, probably you wouldn't. You don't say it to the patient, but in your mind you say it. And so those are the rewards.
Many more other medical doctors have quit the profession out of frustration.
People who can't fight the system might feel it's a lot easier to just drop out.
In 2008, Dr. Kabuye decided to quit this noble profession. He began to tinker with computer software.
It kind of took me up because I could see the results. It had the financial benefits. And the interest was also there, and so the morale was boosted. So around 2008, I thought, well, maybe I could put medicine a little bit on the side and do software design.
This is a discipline he learned on his own without going through formal training as a software engineer. Dr. Kabuye's new profession has won him contracts both in Uganda and abroad.
And up to today, they are running in over 27 hospitals, some in Uganda, some in Kenya.
And like many medical students today who struggle to find ends meet with their parents, Dr. Kabuye started on a government sponsorship throughout his career, but his dream was shattered by the government response.
It saddens me a little bit to see when I walk through health facilities because I got support computer systems and you see somebody needs a surgery and for you it's, that easy, but you're not in the system, but your heart a little bit shrinks and says, oh gosh.
Many of the Ugandan doctors have instead left for greener pasture in other countries, but Dr. Kabuye believes east or west, home is best.
I feel at home when I'm here.
According to research conducted by Uganda Medical Association, hundreds of doctors have fled Uganda to work in other countries between 2010 and 2015. 37 doctors left to the United Kingdom, 12 to Australia, 23 to Kenya, 18 to South Africa, 18 to Botswana, and 25 to Namibia.
The patients have been denied a service for a long time, not particularly because of the strike.
It costs about $21,000, approximately 75 million Uganda shillings, to train a Ugandan doctor. Jingo Francis, NTV.